Hey folks, it's Friday and it's July the 15th, already the middle of July. And everybody is back from 4th of July, but vacations are still going on. So I'm going to talk today a lot about COVID. You know, everybody seems to think, oh, the pandemic is over. Yeah, we had several weeks prior to the last couple of weeks where the cases and the rates were very, very low, very few hospitalizations, and a lot of reduction in deaths. But the pandemic is not over. I can't stress that anymore. I'm gonna bore y'all with some information. I'm gonna put this also in my email because a lot of this is data and numbers, and folks may kind of get lost in all of the numbers. But I got all of this from a series of webinars that the state has been holding every Tuesday, and they're called Grand Rounds. And the presentator on the last Tuesday, the 13th Grand Rounds, was Dr. Jane Kelly. Dr. Kelly is an epidemiologist with Department of Health, and frankly, in my opinion, she's one of the most, well, not just my opinion actually, she's one of the foremost experts in the state and even in the nation around this virus and the implications of this virus. So a lot of the information I'm sharing from her presentation, and I'm going to put some of the details in my email. But for those of you who really want to do a deep dive into this, I will give you, upon your request, the full slide deck from Dr. Kelly. So anyway, here's the deal, folks. 1 week ago, the South Carolina incident rate for COVID was not but 19.2, really low, one of the lowest we've had in quite a long time. In just 1 week, that rate zoomed up to 32.6. Wow, that is a massive increase to take place in just 1 week. And that's not even talking about this week. That was as of data through Friday of last week. So that's really telling us a pretty serious message. The new variants that we're seeing, you've heard of many of them: Delta, there's Beta, there's Gamma. They are much, much more transmittable. They spread much easier. And that really concerns me when I see people out there running around in public and in stores and what have you without masks. That is really, really quite scary. They are much more, as much as 60% more transmittable. We haven't had anything like that in this whole pandemic. The flow of these variants really is coming from the West Coast. So as usual, South Carolina is kind of slow in getting some of this spread. But it ain't going to stop at I-95. It ain't going to stop at the Mississippi River. It's going to keep on coming. So here's some good news about it, though, that the vaccines are still effective. I'm going to have to cut my phone off. I apologize for that. I should have done it, and I didn't. And now y'all are hearing all of my noise. Of course, you'll also be hearing the background office noise too, so that's just part of the busy day. But anyway, back to the vaccine. The vaccines are effective against these variants. Now, they aren't quite as effective as we hoped they were going to be with preventing the disease, but they're very effective against preventing hospitalization and serious hospitalization, like ICU hospitalization and death. They're 94 and 5 and 6% effective against that. So that really, really is good news. So the vaccine does still work. Some of of the other questions that keep coming up, especially over the last couple of months, is do I really need the vaccine if I've already had COVID? And think about that. There are a lot of people that think that oh, they don't really need the vaccine because they've had COVID and they've learned all about the antibodies that having the disease uh, develops, and that's really essentially what the vaccine is doing. It's making your body produce antibodies. But in a short answer, and I'm not making this up, this is from the data that's beginning to become much, much more available. In short answer, yes, you do need the vaccine, even if you have had COVID. And there's a lot of studies that are supporting that. You know, we're learning as we go around this virus. And we're learning more and more because we're getting a lot more ability to study it. We're beginning to get a lot more cases. And a lot of information is getting out there. I could bore you with those details of what those studies say. But they are on the slide deck if you are really interested in seeing them. The short answer is yes. I'm going to repeat it. Yes. If you've already had COVID and think you're perfectly okay, get the vaccine anyway. The antibodies are very important from the vaccine. So, and it's very important to get all 2 doses of the vaccine, by the way. Getting only 1 dose of the vaccine doesn't seem to make any difference at all. And it does make some difference. That was a little bit colloquial for me to say, but the 2 doses are what's really, really important. Fully vaccination. The next thing I want to share with you is around some information that our own Department of Health worked on, and this is real stuff. So they did a study of a little over 1,600 cases in our own state recently for June the 1st through June the 15th. Now, like I said, there were about a little over 1,600 people that were positive, that they had data on their vaccine status. A lot of times they didn't have data. There were a little over 2,000 actual cases, but they didn't have the vaccination status on everyone. And here's the result. This is pretty sobering. For those folks that were not fully vaccinated, that was 94% of those cases. 94% of those cases were not fully vaccinated. And of those that were hospitalized, 90.2% of them had not had the vaccine. And of those that died, 100% of them had not had the vaccine. That's pretty sobering. That is very sobering, especially in the light of the sad event we had earlier this week where we experienced one of our own patients that had not had the vaccine that died. So that's our own South Carolina data. I'm going to switch gears now. I want to talk a little bit about misinformation, or information that is not, I don't want to call it misinformation, but it's really not complete information. And that's information that's going out about all of the risk about getting the vaccine. You've all seen headlines. You've seen, oh, the vaccine causes myocarditis, especially in boys and men aged 12 to 29. They shouldn't get the vaccine. They'll get myocarditis, heart condition. Let me give you some data here, some real data to really think about. So, there's been over 165 million doses of the vaccine that have now been administered. Only 16, that is 1/6 out of every million, have there been cases of myocarditis, heart condition. Now, let's make this real clear. Let's say that we had a stadium full of boys and men aged 12 to 29, and it seated 100,000 of these boys, 12 to 29. Of those that were not, if if the first stadium was filled with 100,000 that were not vaccinated, okay, only 4 to 5 of them would get myocarditis. I had to look at my notes. Okay, so I'm going to back up. So you have a stadium. It's filled with 100,000 boys and men aged 12 to 25. None of them have been vaccinated. There will be 4 to 5 cases of myocarditis. Myocarditis is treatable. It can be temporary. It's a very treatable condition. Now, let's take a look at that same stadium, and let's say that that stadium is now filled with 100,000 men and boys aged 12 to 29 who have not been vaccinated. Okay? All of those 100,000 have not been vaccinated. Here's the deal. 1,100 of them would get COVID. Think about that. 56 of them would be in the hospital with that COVID. 14 of them would be in the ICU in the hospital. Very, very sick. And here's the sad part. And one of them would die. I want y'all to really think about that. Let's quit hollering about the risk and the side effect of the vaccine. Let's instead remember what COVID can do. What COVID can do in terms of hospitalization and death. That's the real risk. It's not the risk of these side effects, which no matter what you have looked at, the data is just not there to say that those risks are overwhelming. The risk of COVID is serious. And you may be saying to yourself, oh, I know people that got risk and they were asymptomatic, they didn't get sick at all. Okay, for now. For now. You know, we are learning more every single day, and Dr. Kelly's data had it in abundance. We don't know the long-term effects of COVID. There are cases and situations, plenty, where folks that were completely asymptomatic with COVID now started having conditions that began to appear that they never had before. And for those that did have the COVID and got over it, the long haulers, as we are calling them, are having serious long haul complications. You know, I had a doctor a long time ago, one of our first doctors that we hired at CareSouth when we were still Society Hill Family Health Clinic, who told me one time, and he was a cardiologist by practice. He was amazing. He didn't have the best bedside manner, but he was still amazing. I'll never forget what he told me. I came down first with the flu. This was back in 1981. And I progressively got sicker and sicker and sicker. I even had a case of pericarditis. Dr. Horn came to my home and he told me something that I will never forget. He said that a virus is the worst thing that can invade your body, the worst thing that can happen to your body. Worse than a bacterial infection, worse than almost anything, a virus. And that, folks, is what we have with COVID. We have a virus that we have never had before. We don't even know some of the consequences. We don't even know what can happen with it. What we do know is that we have a vaccine. What we do know is that there are studies to say that even though there may be side effects, there's side effects to everything. There's side effects to taking Tylenol. That the side effects and the impact of COVID is so much more worse. That message has got to get out because this pandemic is not over. And as a matter of fact, we are very concerned about a surge that could be ahead of us. Very concerned. So hear this message really, really clear. Understand that when we ask you as you come into work and you're having coughing and symptoms, and oh, by the way, the symptoms of the Delta virus are not like they used to be with the original virus. It's not always presenting itself as just coughing and fever and all of that. It's got a little more subtlety to it with even more GI presentation. But anyway, understand we've got to send you for testing. That is just something that we have to do to keep our employees, your co-workers, and our patients safe. So I've asked all the supervisors and the site administrators and everyone to be very, very attentive to that. We're not making you check in now with fever, temperature checks, and so forth. But we are carefully assuring that when we see illness and symptoms present, just run over to the lab and get tested. What if you were positive and you exposed everybody around you that day? Oh, what a terrible thing that would be. Okay, I've got to wrap up here because otherwise I'll keep going and y'all will get tired of listening to this. There's one other thing I want to talk about. I want to remind everyone that a dollar donation program is going very strong. We've got a really good balance in it. There's a lot of need out there. So folks, remember that dollar donation program. You can petition for resources out of that. And we can meet an awful lot of need with that program. The last thing is we are rolling out a new communication tool. We call them news alerts. They're going to be documents that are placed on your desk, workstation, or in your hand by various people that we have designated across the organization. Email is not the best thing to communicate, and we understand that. Not everybody opens their email every day. Some of you have no need to do that. And frankly, we understand that. That's why we're going to get these news alerts out. Now, you're not going to be swamped with them or anything. I promise you. We're going to keep them in control. But there's a lot of information that we need to get in your hand or tell you that you need to look at online or in your email or so forth. Like this video. So that's going to be a new communication tool that you're going to see start happening pretty soon. Take time. Take a look at them. We're calling them news alerts. They're not going to be news alerts just about COVID. There may be a COVID news alert. The very first news alert that's coming out is indeed a COVID news alert because we are reminding everyone that we have the monoclonal antibody treatment available in Hartsville in Suite B, and it is a lifesaver if the patient can come to us early enough that we can get that IV infusion started. It's only an hour, then they have to wait another hour, but that is a lifesaver. Make those referrals. Get anyone you know, and you don't have to be a patient with us. We'll take referrals anywhere. Let's save some lives with monoclonal antibody treatment. All right, folks. Well, my last point, stay safe. The pandemic is not over. As a matter of fact, it's ratcheting up. Wear your mask when you're in public areas. At CareSouth, you got to wear your mask in all public areas. And be very, very careful. Please. All right. We'll talk next week. Bye-bye.